Good evening to our listeners and viewers, and welcome to SAWOPA's Health Literacy and Psychosocial Virtual Sessions in support of patients living with chronic illnesses. My name is Dr. Nightingale Nolwazi Putuka. I'm a general practitioner with a keen interest in holistic wellness. And today I will be talking to you on cancer. This is actually section 2 of cancer. We spoke about cancer, we defined cancer, and we spoke about the differences between cancer cells and normal cells. We also watched 2 videos. In the first video, it was the effects of breast cancer, and the last video was a video on breast self-examination. Cancer is one of the major killers throughout both the developed and the developing world, including South Africa. So today I will be talking to you about the top 5 cancers in women, in men, and in children. And we'll also end off on how we can best prevent ourselves from cancer. Okay. According to the South African National Cancer Registry, this is the latest report that we have, which was compiled in 2017. It says that we have like 1 in 7 women will have breast cancer, cervical cancer, colorectal cancer, uterine cancer, or lung cancer. And 1 in 6 men have a lifetime risk of prostate cancer, colorectal cancer, lung cancer, non-Hodgkin's lymphoma, and bladder cancer. So according to the Cancer Association of South Africa, the top 5 cancers that affect women are, as you've seen in the previous slide, breast cancer, which was discussed in detail in our first session on cancer, cervical cancer, colorectal cancer, and uterus cancer. So what we spoke about when we did breast cancer, we mentioned that many women who are under 40 are diagnosed with breast cancer. We also mentioned the fact that being overweight and having low levels of physical activity add to breast cancer risk, especially after menopause. Alcohol and tobacco use increases the risk of breast cancer, and all women, irrespective of the age, are at risk of breast cancer, but family history increases the risk. Women who have never had children or who had them after the age of 30 have an increased risk of breast cancer. And we mentioned that early detection is key. And how is that achieved? It is achieved through monthly breast self-examinations. It is achieved through going for regular screening, clinical examinations at centers that take care of cancer patients. And it is also important that symptom-free women aged 40 to 54 should also go for a mammogram every year. And women of 55 years and older should change to every 2 years. Okay. And now, moving on to cervical cancer. Okay, as mentioned, this is the second most common cancer. And what is the best way of preventing this is going for your regular Pap smears. And what are the symptoms of cervical cancer? We have abnormal vaginal bleeding between periods, continuous vaginal discharge, menstrual periods becoming heavier and lasting longer than usual, vaginal bleeding, and increased urinary frequency, and vaginal bleeding even after menopause. And what are the risk factors for cervical cancer? Failure to use protection when you're intimate with your partner, sexually transmitted infections, having many sexual partners and high sexual activity, having first sexual encounters at a young age, being overweight or obese with low physical activities, and consumption of alcohol and smoking as well. So cervical cancer can actually be effectively treated if detected and diagnosed early. A Pap Smear is a reliable screening test for early detection of cervical cancer, which is actually a swab of your cervical cells. Women of ages between 18 and 25 who have never been who are physically sexually active should have a Pap Smear every 3 years or 2 years. Okay, now moving on to the third most common cancer in women, colorectal cancer. This is also associated with, I think you will hear as I go through the cancer types, you will hear, I will keep on repeating lifestyle risk factors. For example, lack of physical activity, low fruit and vegetable intake, low fiber and high fat diet, tobacco use, consumption of processed meat, alcohol use, and being overweight and obese. What are the signs and symptoms of colorectal cancer? Many people might experience no symptoms at all. However, some may have change in bowel habits, including diarrhea or constipation. You may have rectal bleeding or blood in the stools. Some patients may have persistent abdominal discomfort, cramps, gas or pain, a feeling that the bowel doesn't empty completely, weakness or fatigue, and unexplained weight loss. And other risk factors may include inflammatory bowel disease or personal or family history of colorectal polyps or cancer. And remember, with each and every cancer, early detection is key. So most colorectal cancers begin as a polyp, which is a small growth of tissue that starts in the lining and grows in the center of the colon or rectum. So your treating doctor will have to do a colonoscopy to check for the polyp and remove it surgically. So patients, or rather, we should go for regular colon screening tests, such as colonoscopy or a sigmoidoscopy from the age of 50 years onwards, and this should be done every 10 years. And remember, an active, balanced lifestyle significantly lowers your risk for colorectal cancer. Now, the fourth common cancer affecting women is uterine cancer, which is the cancer of the uterus, also known as endometrial cancer. Endometrial cancer is actually a disease in which malignant cancer cells form in the tissues of the endometrium. What is the endometrium? The endometrium is the lining of the uterus. It is a hollow muscular organ in a woman's pelvis. Cancer of the endometrium is different from cancer of the muscles of the uterus, which is called sarcoma of the uterus. So what are the risk factors of uterine cancer? It is genetics, inability to fall pregnant, infrequent menstrual cycle or starting menses before the age of 12, estrogen replacement therapy with the use of progesterone, and diabetes. Advanced age is a risk factor, tobacco use is a risk factor, lack of exercise is a risk factor, and alcohol use is a risk factor. A patient will present with abnormal vaginal bleeding or discharge that is not normal. And one may also present with pain in the pelvis or abdomen, especially when passing urine. Now, moving on to the last type of cancer that affects women, it's lung cancer. Lung cancer is actually the leading cause of cancer deaths in men and women worldwide. Smoking counts for the majority of preventable lung cancers. Lung cancer is mostly common in men. However, since women also smoke, the number of women developing cancer has increased. People who do not smoke can also develop cancer, and survival rates for people diagnosed with lung cancer are very low. People diagnosed at earlier stages have the greatest chances for recovery, as with all other cancers. So what are the signs and symptoms of lung cancer? A new cough that does not go away, changes in chronic cough, or what is known as smoker's cough, a cough that gets worse or does not go away, coughing up blood, even small amounts, shortness of breath, or what is known as wheezing, constant chest pain, especially when coughing, frequent chest infections, wheezing, swelling of the neck and face, fatigue, loss of appetite, loss of weight without trying to lose weight, bone pain, and headache. So how best can you manage your lung cancer? Quitting smoking at any time can lower your risk. Remember, exposure to secondhand smoke also increases the risk of cancer 2 to 3-fold, which is actually very high. A healthy diet and moderate physical activity plays a role in lowering risk. Exposure to asbestos increases the risk, and combined smoking increases the risk greatly. Chemicals used in industry and around homes may also increase the risk. Labels on home products such as wood strippers and material safety data sheets provide information on safe exposure and proper masks to use. Exposure to random in-house is the second leading cause of cancer, radon, overall, and the number one cause in non-smokers. Radon is an invisible radioactive gas that results from the normal decay of radium in the soil. Okay, now let's move on to the big cancers that affect men. Number one on the list is prostate cancer. Prostate cancer often occurs without any symptoms, but if they do occur, a man will present with the following: frequent urination, especially at night, straining to pass urine, painful or burning sensation during urination, leaking urine, bloody urine, and advanced cancer can cause deep pain in the lower back, the hips, and the upper thighs. Okay. So screening is important to reduce the risk of cancer. And some of the risk factors include, your race. African men are predisposed to getting prostate cancer, a family history of cancer, age, which unfortunately cannot be helped. And then eating a healthy diet will definitely improve your chances of getting cancer. Men who eat a lot of red meat or high-fat dairy products are at a higher risk of developing prostate cancer. High alcohol intake also increases the risk. As you listen, almost each and every type of cancer has healthy eating as a protective measure, stopping drinking or limiting alcohol intake, quitting smoking, and maintaining a healthy weight. Those are the risk factors that are modifiable. And another thing that increases the development of prostate cancer is the use of steroids. So how do we screen for this? Screening is done with a blood test that is known as prostate-specific antigen test, commonly known as PSA. This helps to detect prostate abnormalities. Any inflammation of prostate will be visible on this test. So if it's raised, you will be referred to a doctor to do a digital rectal exam to just palpate if the prostate is enlarged or not. Okay. Then number 2 on the cancers is colorectal cancer, which we also mentioned for females. So I'm not going to repeat the risk factors, which are, your lifestyle habits. And I'm just going to say in men, you need to go for regular colon screening tests, such as a colonoscopy and sigmoidoscopy from the age of 50 and every 10 years, the same as for females. And we also mentioned that just to refresh your memories, change in bowel habits is a symptom, a feeling that the bowel doesn't empty completely, rectal bleeding, stomach pain, weakness, and unexplained loss. So should you experience these symptoms, you need to contact your doctor as soon as possible for further tests to be conducted. And treatment depends on how far the cancer has advanced. Treatment may include surgery, radiation, chemotherapy, or a combination of these therapies. And prognosis also depends on how far the cancer has advanced. Now let's move on to the third type of cancer, which is lung cancer, which we also spoke about in women. Even with this, we mentioned that symptoms include shortness of breath, cough, coughing up blood, chest pain, noisy breathing, feeling very tired all the time without any cause for feeling tired. And screening includes examining the lungs with a fiber optic telescope, sampling sputum to look for cancer cells, doing a CT scan. And if you are older than 50 years of age and have a history of smoking, or if you have chronic obstructive airway disease, you really need to talk to your doctor about screening for cancer of the lungs. How do we lower risk? It is estimated that the risk for lung cancer can be lowered in 90% of cases through action and awareness. Smoking accounts for the majority of preventable lung cancers, but non-smokers can take action to also lower their risk as well. Remember, we said it's not only active smoking, but passive smoking as well, which can contribute to lung cancer. So the best way to prevent lung cancer is to not smoke and to avoid secondhand smoke. Treatment also depends on the type of cancer, its location, how advanced it is. Options also include surgery, radiation, chemotherapy, or a combination of all these three. Prognosis also depends on whether the cancer has spread or not. Now, the fourth type of cancer that affects men is Kaposissarcoma. Kaposissarcoma is a cancer that actually affects the skin. It presents with dark lesions on the skin. It is actually very common in patients who have HIV/AIDS. And finally, let's move on to bladder cancer to make sure that we stick to time. Signs and symptoms of bladder cancer include the following: blood in your urine, and the blood may change color of the urine or show up as blood clots. You may feel like you want to urinate frequently. You may also have burning pain when urinating. And what are the biggest risk factors? Smoking. Smoking doubles your risk of bladder cancer. Having a family history of bladder cancer, being older than 55 years, is also a risk factor for bladder cancer. And screening investigations are done based on your symptoms, However, tests may include a cystoscopy, a biopsy, laboratory, and imaging tests. Now, what is the treatment and prognosis? Surgery is the most common treatment. Additional treatments may include administering drugs directly into the bladder, chemotherapy, radiation therapy, and like all cancers, prognosis depends on finding the cancer early. So the earlier the cancer is detected, the better the prognosis. Unfortunately, if it's detected late, prognosis is also going to be bad for patients. Now, what are the top 5 cancers that affect children and their symptoms? Number 1, we have acute lymphoblastic leukemia. This is the most common childhood cancer. It affects 25% of all cases of cancers in children. It typically occurs between the ages of 2 and 4. It is more common in males. It begins in the bone marrow and it spreads to the blood, then to the organs. How does this present? It presents with bone and joint pain, fatigue, weakness. A child may also present with bleeding, fever, and weight loss. And what is the second type of the most common cancer in children? Brain tumors. Brain and other nervous system tumors make up plus minus 13% of all cases of cancers in kids. There are many types of brain tumors, and treatment and outlook of each type of cancer is different. Most of them start in the lower parts of the brain. And how do these kids present? Kids will present with headaches that are not stopping, chronic headaches in children, dizziness without any other cause, loss of balance, vision problems. I mean, we expect kids to have good vision. So if a child presents with low vision, they need to be examined. Hearing or speech problems may also form part of the symptoms of brain tumors, and frequent vomiting. If you have a child who presents with frequent vomiting, you need to take them for consultation so that they can be examined, and differential diagnosis can be determined, and also tumors can be excluded. The third most common type of tumor in children is neuroblastoma. This arises from immature nerve cells in infants and young children, actually children who are younger than 5. It often begins in the adrenal glands, and this is also more common in males than in females. How do these kids present? Kids present with impaired ability to walk. They present with changes in eyes. You get bulging of their eyes. They may also have dark circles around their eyes. They may also present with droopy eyelids. And sometimes the kids may present with pain in various locations of the body. And another feature is diarrhea. And finally, high blood pressure. I mean, we do not expect kids to have blood pressure that is high. So a child that presents with constantly raised blood pressure needs to be examined to exclude any types of cancers. Okay, we also have Wilms tumor. This is a tumor that usually forms in one kidney. However, it can sometimes form in both kidneys in a number of small cases. And it is typically found in young children who are between the ages of 3 and 4. And how does this present? It presents as a swelling or lump in the belly. Presents also, the child will present with history of fever, history of pain, nausea, and poor appetite. So if a child presents with these symptoms, you need to take them for a consultation and then they will be investigated. And with investigation, we rule out other causes of these conditions. And obviously, if a child has a family history of cancer, we will make sure that we screen for these kind of tumors as well. And finally, the most common type of cancer in kids is lymphoma. Lymphoma starts in the lymphocytes. Lymphocytes are cells which form part of the immune system. This affects the lymph nodes, the lymph tissues as well. We have two types of lymphomas. We have Hodgkin's lymphoma, and we also have non-Hodgkin's lymphoma. Hodgkin's lymphoma is rare in children younger than 5 years of age. It's the same. It's similar in children and adults. And more common, the non-Hodgkin's lymphoma is more common in younger children, but it is still rare in children who are younger than 5, and it tends to respond better to treatment in children than in adults. And then how does lymphoma present? Lymphoma presents with swollen lymph nodes in the neck, or in the armpits, or in the groin area. A child may also present with weight loss. Sometimes a child will present with fever, sweats, and weakness. And as you can see from these symptoms are non-specific. So if a child presents with these symptoms, they will need to be investigated. Investigation will include collecting blood, will include doing X-ray investigations and other tests to exclude other conditions before saying a child has a certain type of cancer or not. Okay, now having spoken about all these, let us conclude. We know that early detection is key. So how is early detection achieved? It is achieved through cancer screening. And what are the aims of cancer screening? What are the main goals of cancer screening? To reduce the number of people who die from cancer, to prevent cancer-related deaths, to reduce the number of people who develop this disease. And as you've heard from the common cancers in men and women, we mentioned that each and every type of cancer has its own screening test. Some types of cancers currently do not have an effective screening method. However, developing new cancer screening tests are an area of active research. So as soon as anything is confirmed, it will be released to the public. So how best can we do at preventing cancer? Okay, the best, we all have a limited ability to prevent cancer. It can happen despite a person's best efforts to follow screening recommendations, to eat well, and to stay healthy. However, even though we cannot guarantee our future by lifestyle choices, we should still modify our lifestyle choices. So the best way is healthy eating choices. You've heard in the beginning that you need to eat a diet that's high in fruits and vegetables, high in fiber. We need to also have regular exercises to avoid obesity, because remember, obesity is linked to cancer risk, and it also regulates hormonal levels that are known to affect cancer risk. Cigarette smoking is a strong risk factor for lung, blood, esophageal, kidney, pancreatic, and head and neck cancers. So avoiding or quitting tobacco is the most important decision you can do to lower your risk of cancer. Limiting how much alcohol we drink is also very important. We've learned that in total, life exposure to alcohol is an important determinant of future risk: breast cancer, esophageal cancer, liver cancer, colorectal cancer, stomach cancer, mouth and certain cancers of the head and neck. So limit your alcohol intake. And finally, protect ourselves from UV rays, which increases our risk of developing skin cancer. So in a nutshell, if you discover any abnormalities in or on your body, for example, lumps or moles, please consult as soon as possible for further management. Further management will include investigations, screening, and differential diagnosis, and of course, ruling out